was supposed to deliver Winston at New York Presbyterian. But since I was home for Father's Day, it was a Sunday night, I just stayed over at my parents' house, and my water broke at 3 in the morning. So he was at 32 weeks, so we called the ambulance and called my doctor in New York, and although they wanted me to come into New York, I was not in a position to go very far, so this was our first destination. And actually the doctor in New York said this is exactly where we needed to go because of the level 3 NICU, not knowing what state I was going to be in when I was received in the emergency ward.
Winston's main focus initially was the fact he was born at only 2 pounds 4 ounces, and he was born quite prematurely. He was fortunate that many of the serious complications of prematurity he did not have, but he had a significant surgical malformation where he has this absence of his esophagus, which never formed properly. Often for these babies, this problem is not isolated, that they not only don't have the esophagus forming properly, but it's often associated with other organs that did not form properly. So in Winston's case, he did not have the whole list of things that could happen, but he had many of them. And that would include how his little bones formed. So some of his vertebral bodies to this day are not normally formed. And at some point, he might need surgical repair of those. So it's a great example of how in a children's hospital, it wasn't the issue at birth. It really isn't his issue today. But at the time of puberty, Winston will need to be followed closely and need to be seen by orthopedic surgeons to make sure that those bones are, although they're not normal, that they're growing normally. And he most likely will need surgery for those at a later date. He did have problems with how his kidneys formed. Fortunately, it was not a major issue. It required some minimal surgery at birth, but it really won't require any significant long-term follow-up. And that's why I sort of think of like a children's hospital like Goriab as this mosaic, these threads, because you have these subspecialists who come to the forefront at different ages at different times.
Goriab is so special for so many reasons, but for me it's the doctors. The doctors have obviously helped my son, but have helped me, get through the last 4 years, explaining everything perfectly, making me understand what's going on and where I need to go with regards to Winston's health. And so from at every level, the care has been just tremendous.
Dr. Pang and I have been Winston's pediatrician since birth. We have been taking care of him since his discharge from the neonatal intensive care unit at Goriab Children's Hospital. He was there because of complications from birth, prematurity, and tracheoesophageal fistula. We provide his normal newborn care, his immunizations, acute care visits, and help in coordinating with the care with his subspecialist.
He's become this healthy, vital, cute little boy who has a terrific family, and the world is open to him. So it's an exciting time to see.
For me, Goriab's the place to be. You can't do any better, and this is why I'm staying here, close to home, close to Goriab.